We want to wait for this to make sure, or? Okay. Good evening, everybody. We're going to reconvene open session. Welcome tonight. Thank you for joining us. Well, we're starting an hour early for a very special meeting. We got only 3 agenda items, but really big ones. So before we get started though, do we have any audience input on items that are not on the agenda? So if your comments are specific to either the True North strategic plan, the budget, or the capital plan, we'll cover those comments during those agenda items. Any audience input outside of those? No, and then none online?
Yeah.
Okay. Any input from employee associations? Seeing none, let's get right into it. Item 10. Item 10.1, True North strategic plan, and I believe we'll look to you to kick things off.
Good evening.
Gave you the mic and I ripped it right away. I just want to go like a massive amount of work went into this, and not only from those in the community to those on staff. And so before we even get, it's one of those like, hey, if I forget to tell you later, I had a great time. Like, thank you. This was, an insane amount of work that went into this. And unlike, I think, any presentation we've seen relative to a strategic plan, at least in my time here. So thank you. And that goes to everyone on TV, everyone in the room. Thank you.
Well, thank you.
Now you get the mic.
Good evening, Chair McGarry and members of the board, members of our staff and community here in the room with us tonight and who are also tuning in. I will add to the message of gratitude to say we're really excited to be here tonight. I'm joined tonight by our CFO, Crystal Felix, but we're actually representing the entire Tahoe Forest team in really a message of gratitude to our board, to the community, and to our staff because of all of the robust input that we got. I think the very authentic input. We were able to really put together, I think, a responsive plan to the community. So we're excited to bring that to you tonight. It's going to be there's a little bit, we're approaching this a little bit differently than we have other budget meetings. So tonight you're going to hear a brief overview from me of the 85-page report that you should find, and that's also for those who are viewing, that's publicly posted. We'll kind of sprint through an overview. Then Crystal will take us through the budget, which you will see that is directly sort of connected to the strategy. And then we're going to open up for questions and answers, which we will likely draw sort of on all of the expertise sort of sitting here in the front row, and then we'll hand back to all of you. So if that's okay, we'll get started. So I think, again, this is really, we've titled this True North 2030, but I do want to say that we really are starting, it says 2027 to 2030, but we really are starting at 2027 because it is such a active year in health policy. Okay. All right. Okay. And with that, I just want to say yeah. So again, I think, what we just want to set the stage here. This is really presented as a strategic plan, but this is really our response to our community and the changing environment that we're in. And you're going to hear a lot more about that. You're also going to see a little bit different as we go through the strategy. You're going to see direct tie-in of the investments. And so again, I just want to kind of set the tone. This is a little bit different way to present it, but hopefully this will feel comfortable for people to follow along and formulate their questions. And again, we will happy to answer those questions. As you all know, the True North really has been taken shape around three sort of guiding principles: health within reach, community guided, and transformation. I'm going to talk more about that as we get into the presentation, but just want to say that those have been pretty consistent since the beginning, and those have been really what the community, our workforce, and others have really told us are the key themes. So you're going to see things formatted and organized in that way. Before we go to that, though, let's just start with Tahoe Forest itself. I mean, really, we've talked about this a lot. Founded for this community, by this community, philanthropy driven. I won't go over all of the recognitions for excellence, and frankly, we could have another page there. We just decided to go with the top level ones, but there are many accolades and recognitions, well-deserved recognitions of the work that our staff is doing every day on behalf of this community across 2 states, 6 counties, in those 2 critical access hospitals that we have. One we're sitting in here and one over at Incline Village, as well as the skilled nursing facility. We are currently now serving over 50,000 residents. This was sort of a funny number because our business intelligence lead, Forhad, said, you know, we're serving more people than actually show up on the census. Part of that is because of visitors, but also part of that is because, as you recall, the census was really done 2018 to 2020, and then we had COVID. So a lot of people decided, you know, I think I might live up here in Truckee, or at least sort of part-time, half-time. I think I'm going to sort of get my health care there now and establish, as people started to have new kinds of existence with Zoom and those kind of things, that isn't now just tech people. A lot of people in a lot of industry are able to have a lot more flexibility, and so they've chosen to spend a lot more time here. Again, you see those 166,000 outpatient visits. You'll see along the slides at the bottom, actually, throughout this presentation, we have a few little factoids here and there. I'm not going to actually mention those, but there's just so much going on that we kind of embedded it all over, even in the design. What I would draw your attention to is that the $787 million projected gross revenue for this year, you'll see later that number grows for next year in Crystal's projected budget. But we're different than we were even a few years ago. Most of the data that you're going to see, where we do kind of comparisons over time, because that is a theme here. We have been in the midst of stratospheric growth here at Tahoe Forest and here in the Truckee and Tahoe, North Tahoe region. Again, we actually kind of put that 2019 there because we know that the pandemic played such a big role in kind of changing the local environment. Again, some stats there, but 1.9, so 1,900 employees, and we'll talk about the breakout of how those look, but not all of those are employed, but that does make us the largest employer in the region, and that is even up against sort of Vail and Altera, those big ski operators. We still are bigger than them. So we really have a pretty big duty to be responsive to our community, which again, why it was so important for us to go out and get those voices from the community. We highlight the patient satisfaction here, not just because I mean, it feels sort of like it's an arbitrary number, but this really puts us in the top performers in the country. And I think one of the things that we really, again, want to do is acknowledge that work on behalf of the staff. It's hard to actually get 95% and stay there for years on end. And so I think this is really just an important acknowledgement of what the staff are doing every day, that what's going on right outside the doors tonight. And again, I think that we also want to say is that even though I think a lot of people think about this is a region a lot of people are moving in and out of, they're vacationing, we know that 88% of the people that call this region home receive care here. So I think it's really important to understand that just you think about sort of a 25-bed, small, rural hospital, critical access hospital, but we're playing a very outsized role in this region. So just kind of wanted to walk you through some of those numbers. Why are we even doing this? I mean, we're doing pretty well. We've been doing really well. I mean, I just took you through a bunch of our awards and stuff. But last summer when I first arrived, I think our board chair had this kind of question he would pose on a pretty routine basis, like, what does it mean for a health system to be the center of health in a community? I love that question. I think that question was really kind of set us off on this year of introspection, of discovery, of really asking that question. We went out, we asked the community that question. I mean, luckily we didn't have to do this alone. We had the community health index sort of survey going out, lots and lots of people. We leveraged all of our communication people. But I think the reality is that we really were designed and had the infrastructure and the system in place to be a critical access hospital. But I think this was a recognition that we're doing a lot more than that now. And what more should we be doing as we plan for the future? One of the things I will just say, having come from a very different kind of environment where the bottom line looked much differently, is many might say we're in a very privileged position here. And I love Director Brown sometimes says we're breathing rare air up here. But I think that what that really is privilege, and the question really behind this, I think, was what are we going to do with that privilege? How do we spend down that privilege? And I think, so again, as we kind of approached our discovery with our community and with our workforce, it was really with these kind of questions in mind. So we went out, and the methods that we used is we actually went to industry experts, A&M, some of them are here in the room with us tonight, and other industry experts. We looked at our market analysis. We brought in people to give us a view across the country, what was going on here in the state of California with other hospitals like us, which, by the way, there really isn't any. But we did, benchmark up against others. We also looked at our own data, which was pretty breathtaking when we started to look about how much we actually had grown, what's really going on with our workforce and our employment agreements. There's a lot of things that we do. It's like we're doing that at that scale. We didn't even know, as we really started to unpack and look into everything. And then finally, we went out into the community, and we sought to get 5,000 touch points from the community around really what does it mean to be the center of health? Where are we sort of meeting? Where are we meeting the expectations? Where could we grow and strengthen? Where could we improve? And I will say, we got over, you kind of see down there in the little bottom, we got over 6,500 pieces of feedback from people. And I just want to pause for a second, and I want to thank the community for coming out, for scanning the what are they called? QR codes, sorry. What's it called? For board members showing up to coffee houses and, ski races. And it was actually a lot of fun. It was a lot of hard work. I want to recognize our partners in our communications team, ERPR. We had staff everywhere getting this input. So I just want to say that I don't think we have seen an undertaking like this in the system before. And I do want to give a shout out also to the library. The way the 5,000 Voices came to be is that we were in a meeting, and the library had come that night to get, I think, an endorsement from our board. And they said, we got 4,000 pieces of input from the community. And so Kim McCarl got up and said, well, we're going to get 5,000. Okay. But we did get 6,500. So I just want to say that what I want to say, though, is that this isn't really about the executive team going into a conference room and kind of contemplating and deciding on behalf of this community what the future was going to look like. This is an informed analysis. What we heard in this, and we heard this kind of across the board, not only from the industry experts, but also from our local community. We heard that we are not protected from what's going on in the rest of the country. I mean, healthcare is changing in volatile ways across the country. I mean, the cost of doing care is rising. The demand is rising. We have new market disruptors. not only just in healthcare, like places like technology and that sort of thing, but even right here at lake level, where we were seeing, in a very traditionally stable environment, we've seen new entrants come into the market with Barton partnering with Cleveland Clinic and Renown partnering with Kaiser. We saw long-term relationships between Barton and Renown over there at Carson Valley change their positions. So, I mean, you could change this to the Lake Tahoe outline and all of these things would still apply. And I think it's just really important to understand that I think we've been in a very stable and protected environment. And just like the year, do you all remember when the fire for the first time breached the granite walls over in the south side and everyone had to evacuate? Right. But, the granite walls protected us, it's not the case anymore. We can no longer count on geographical sort of isolation, particularly when we have these invisible entrants like telehealth and those sort of things coming in. But, again, I think the other thing is I just want to point out sort of down there at the bottom, which is it looks, kind of equal to everything else, this federal and state funding uncertainty. But we know that this is probably the most volatile policy environment that healthcare has ever been in since I've been a healthcare leader. And I will say that I started as a CEO like in 2008 or 9, and I joke, I've never not been being reformed. Like, I feel like I'm like a CEO that's super comfortable leading through change, and it's uncomfortable. I mean, we're in some very, heavy times, and healthcare is a really large economic target, which makes it a very large policy target. But what we do know is that we know that we're going to see an increase in uninsured and underinsured. We know that we're going to see changes in the Medicaid and Medicare program coming both at the state level and the federal level. We know those are coming. How those are going to take shape, that's for Crystal and her crystal ball. But we can count on change coming. So I think, again, one of the themes that you're going to hear is that, and one of the reasons why I have so much confidence as I look at a daunting chart like this is part of the attributes we will need as we move forward is adaptability. We have to be adaptable. And the reason I have so much confidence is I have spent the last year talking to our community, talking to the people who make up the Tahoe Forest team, and they are adaptable. So I think I feel very confident as we greet these challenges that we can greet them with enthusiasm and creativity, just as we have, in years before. So you'll hear more about that. But let's talk a little bit again about growth, because I think this is the theme. And I think, again, a lot of the systems and structures that we have in place are really the 2019 and before structures. And I'll tell you why, because in 2020 to 2023, let's just erase those years. People were busy just trying to make it to the end of the day. And so really we lost about 3 years, all of us across healthcare. And now we find ourselves in 2026 and many of those, and in an entirely new system and an entirely new environment. And I want to just give a shout out. I mean, I could have a chart like this for every service line, but let's give a shout out to the pharmacy. When, they've increased by 241%. And this is in a time when places like Rite Aid closed down, places like, other local pharmacies have either reduced or eliminated their hours. We've seen a lot of people exit the market. Our pharmacy is open 364 days a year. And so I just think like that is pretty incredible. And they are, you can't go in there without seeing them hustle. I mean, they are hustling all the time. So I just want to acknowledge sort of the hustle that's going on across the system. So the other thing I want to point out, again, the small fact down there on the bottom is the revenue growth. We have been growing very rapidly over the last 10 years. And again, you're going to hear Crystal talk a little bit more about that. But that with that comes a burden of ensuring you have the infrastructure that can support that kind of growth. And I would like to dub 2027 the year of infrastructure. We will be putting in some infrastructure to really help drive change. And I think it's a very exciting time because what that means is then sort of what goes on beyond that will be really, I think, a whole different, set of adjacent possibilities for this system. So let's talk a little bit about kind of move from strategy to action. Let me just summarize what the data, what the industry experts, and importantly, what the community that includes both people living, visiting, and working here told us. They told us we need you to improve access. They said, I think we talked about this earlier. There was sometime in the last few meetings, public meetings, we actually went over the data for the 5,000 voices. And one of the data points I think that our chair was struck with, and all of us were struck with, was that over 40% of it was negative. And that negative data, the vast majority of it, wasn't that they didn't like us or they didn't like our care. Kim tells a story. She used to live in a region where people would get in the ambulance and say, "Take me anywhere but." That's not the situation here. People are saying, "Take me to Tahoe Forest," and people are saying, "I want to get my care at Tahoe Forest." And I think this is one of those areas where we, really acknowledging the growth and whether have we actually kept up with it. And I would say that even as I sort of examined Tahoe Forest and its history and legacy, it was very clear this is a critical access hospital. That's very clear across all your structures, your paperwork, if you read it, if you review it like I did as an outsider at the time. But there's not a lot that really recognizes in our structures and our policy that people now aren't looking at us as a stopover and a referral center. In fact, you'll see somewhere on one of these facts, 88% of people get treated and stay here. Actually, the vast majority don't get sent out. But they see us as their health home. And the question is, do we see ourselves as that? And I think that, that is sort of what they are saying is, we want you to be more. And we're disappointed that we can't get more from you because we really don't want to drive down the hill. We'd like to stay here. We love our doctors. We love all of the care team. We love when we come into the cafeteria. We like everything about Tahoe Forest. So please don't make us go at other places. The other thing they said is, we want to see you invest where it matters most. Right? We want to understand those investments. So again, you're going to see some of the investment strategies sort of put right out there, and it's really going to be directly attached to those 5,000 voices or those 6,500 touch points. They also said, tell us what you're going to actually do and then do it. Be really clear. And I think, again, we want to be able to know what you're doing so we can support you, so we can be involved, and so we can actually participate in a meaningful way in helping you, because you are our system. This is our system. And then finally, I think, again, the data told us particularly, and I think this was an assumption by our community, like, you better be ready to adapt to the changes. This, again, I think we have, you'll see this in our transformation sort of arm, but I think we have such abundance here on our team and really in this region that I feel really confident. And we have a lot of work to do to really build muscle in adapting. Which I think one of the things I find so interesting about this region is how people in general in this region just do so many challenging things, like by choice. Sorry, that sounds very, but it's so true. I mean, you know what I'm saying. Everybody knows what I'm saying. So, yeah. But, so I think, it's only fitting as your health system. We learn how to take on challenges. Everyone here goes large. That's what I've noticed. So, and I think what they want to see the system go large. So, this should be, hopefully this is a reminder to many of you who have been following along, but for those who haven't, and this might be your first view into the True North strategy. Again, we have three sort of areas, categories with aims. This is not the measurement strategy. I just want to say these are our aims. Our aims are health within reach. And that's about access. That's about expanding choices. That's about affordability, lowering costs. And it's also about creating, increasing convenience. That's sort of a newer concept in healthcare. But we actually are seeing that people kind of have a completely different view than maybe they had 15, 20 years ago. And again, we heard this very loud and clear from all of our different inputs. The other thing we heard is when you grow, we want you to grow in partnership and with meaningful engagement from the community. We want to be involved. We actually want to help shape how you grow, like we did with the hospital itself, like we did with the cancer center. We want to be meaningfully involved, and we want to have say-so. We want you, and that really, the transformation sort of arm kind of goes farther into this on the how to. And like, I think what the burden is on us is like, we expect you to share these important decisions. We want a space at the table. We want to, and I think that is actually something that Tahoe Forest, I think, does very well. It's not actually done very well in healthcare in general. Healthcare is a pretty paternalistic industry, but I think here in this region, people again, I think because of the structures were built literally by the community, they said, we want to be involved, and we expect you to learn how to have competency in sharing the road with us. And actually, we want to see you be accountable to us too. So again, those are our aims, and we'll come back a little bit with that. But I'm going to go a little bit into both kind of how we're viewing these aims and then how we're investing. And then I'll be handing over to Crystal. But again, the health within reach, this is, I won't read to you the left side there, but just to say, this is really about access and affordability. So you're seeing that in your budget, you will see, and what we sort of have over here on the right side is the investment. Those are to create more front doors. Not just doors to the exam rooms, but, to contemplate, and we are planning, again, we will bring forward through all the committee structures and the formal approval process, but we are planning for mobile clinics. Mobile clinic will allow us to do many, many things, both in some cases provide primary care, like through a rural health clinic status, but also it will sort of liberate us to kind of show up to other places where access and equity is not sort of, there's not a level playing field, where isolation, we have a geographical region where there are many communities that are very isolated, particularly during certain weather. I have asked Louis if he's going to get a 4-wheel drive. I don't know. Okay, yeah. So, but how that all works as a new snow driver, I'm not sure. But anyway, you've seen them. You see the construction sort of down Donner Pass Road and down at lake level in Tahoe City. We've got 3 large clinics opening this year. I told Crystal she should add $500 to this because we got to get a big pair of scissors because we have so many openings this year. We have so many ribbon cuttings coming up this year. I mean, we don't even have incline surgery on there, but there will be a lot of, you will be at many, we will be out there with the community welcoming them into many new spaces this year. The other thing that's going to be happening in our outpatient is we are exploring and already kind of in the process of looking for partners around both in-house and partnerships around extended hours and virtual care. So I think you're going to see a lot. You're going to see a lot of movement in that area. That's about choice. That's also about convenience. And frankly, in some cases, it's also going to be around general access, because again, most things are sort of located at our brick and mortar sites. And so this will allow us to use those sites fully, but also to create more sites. And then I think one of the things I'm very, very excited about is the cost transparency and financial navigation efforts. I'm actually going to let Crystal talk a little bit more about this one when she does the budget, but this is really about investments around reintroducing kind of our financial assistance program, making that much more accessible, but also bringing in some people, some actually bringing in experts on estimates to make sure people like have easy access to understand what to expect. And there is actually, I think, a really high value in making sure people feel like they can be, they understand what they'll be paying for. Finally, we have what we're calling the lab affordability pilot. This is the successor to the community lab program. This is, and again, Crystal may want to, I will actually let Crystal jump in here on a couple of these things, but in summary, this is a 25% reduction across about 70% of our labs. That will, and that is really a coupling with that cost transparency and financial navigation efforts, because we know even though we are reducing those labs by 25%, there will be some people who that will still be too much. And I think it's really important that we make sure that at that moment that they are easily navigated to our financial assistance programs. So you see that that's sort of where some of those investments are going, and you kind of see in terms of, again, growth and just space and equipment, you kind of see that down there. The last 10 years we've invested $183 million in either space or equipment. So there has been big growth going on across the system. Do you want to say anything about the lab or the financial?
The intent of the affordable lab pilot was really to have that be far more reaching than just the community lab program, which really only touched a very small population. We don't want this to feel like we're taking something away. So it was very important for us to make sure we included a way for those that really do need to access labs with even a further reduced cost out of pocket, that we had the ability to help them navigate that and really navigate it in a way that it feels good, that it's not like we're viewing you as charity. You're keeping your dignity. You're being open and honest with us, and so are we, and we're finding a way to help you get your care. So it's really looking at this from a much bigger perspective that can affect a larger population of the community we serve instead of a very small niche that was accessing the community labs.
Thank you, Crystal. So the next area I want to just kind of pull some of the investments down from, this is around community guided. And again, this is what some of the things we heard from our community. And when I say community, I want to talk about both people who receive care here, but also people who provide care here. What they said is, we want more time with each other. Patients want more time with their providers and their care team, and the care team wants to spend more time providing patient care and not managing, an EHR or helping them to navigate the system. So you're seeing sort of, some people are like, well, why, why are you talking about the clinical AI tools here? I mean, these are the things like the ambient AI or the digital assistant in the office that will be doing the charting for the care provider while they are actually interacting with the patient, and they're so kind of freeing them up to spend more time actually on a human engagement. So it's really smart use of clinical AI. I will say, I just want to give a shout out at this moment to Kyle Cattell and Dr. Gladman, who have been leading the charge of really making sure there's no space between IT and our clinical teams. And this is, it's no small feat to kind of navigate all of this. And I know that Kyle and Dr. Gladman, oh, you're both here. I didn't even know you were here, but so I was shouting you out, even though, but really, it's really difficult. It's really difficult work, and the AI piece of this and the AI governance is. I'm just very grateful to them and the work that they have done and the thought that they're putting into this to make sure that these tools are actually improving the improving care and not something to kind of overcome. So and that is difficult. We have many other investments sort of up there. I won't read them all to you. The other thing that we have here is we have investment in the climate action plan. And that is both, we are actually going to bring on a half-time dedicated position to really work on climate action, but also it has some of our continuing studies with our experts from the industry kind of coming in and helping us. And then finally, one of a very exciting area, I think, is the financial forecasting, modeling, and analysis. This is going to be where our central budget office is. And so I know Crystal's very excited about that, as is Jay. But the other thing I want to say here is that again, we don't have time tonight to highlight everything, but I want to talk. I just want to make note that we do have sort of right here, down here, one of our projects that's going to kind of come to completion in this next year is that incline community hospital surgery and emergency department enhancement, and actually doubling of the surgery space, really in large part to Dave and Cheryl Duffield Foundation, who provided that seed money, and then that Incline Foundation and Carly, who's just out shaking every tree and getting that done. I mean, she is just, she has been just a driving force, creating her own weather out there to get that done, and that will be that will be very exciting. That's another reason we need the big scissors. Yeah, I mean, not for me, it's for the board, but yeah, we probably do need some scissors. And then the next area, I think the area that we're talking about, there's a lot of, we just laid out a lot of things, and there's just this magical, like, how you're going to do it, And if you've ever seen those like math equations where they put this really complicated equation, then it's like something magical happens and then there's a solution. This is the something magical that has to happen. This is really how are we going to build muscle to get all this stuff done? It's partly about investing in you, our board. It's about investing in our community, the fall forum, which I'll do a save the date at the end, but and really making sure we have a place that we come together and learn together. It's about the True North Transformation Center, which we already talked about at just a previous meeting, but really that's around kind of creating a organizing structure to ensure that all this stuff is happening and it's being tracked and it's it's not derailing. We also have in here the workforce strategy, and I would say within your 85-page document, you'll note that there are 8 appendices at the back, and so some of those very specific strategies, the climate action plan, those are in there, and we will be welcoming a new CHRO in August, the first week of August. She will be on site, and then. Also, the data analysis. This is Forhad. We'll be doing. We will be moving business intelligence actually under finance, as recommended by again our industry experts at A&M, which I think is going to be, again, Crystal is going to be pretty busy. So if you guys want something from her, June is the month to go after Crystal. Because starting in July, Crystal's going to be pretty busy. But I think again, this is just kind of the how-to, but I think one of the reasons why we say this is a lot of this is, it's not just sort of creating the muscle to collaborate with the community, but it's just a reminder that 87%, we have had an 87% growth in our workforce in the last 10 years. And in the middle of that 10 years, we also had a pandemic. So we really need to take the time to circle back and make sure we're all we're all like locking arms and everyone feels they're part of the future here at Tahoe Forest. I mean, we have the most amazing staff, and we really want to take the time to invest in that staff and make sure they feel prepared to take us into the future. We talked a lot about a lot of things, and I just wanted to sort of remind you all what we're bringing here tonight to you is the strategy. We want to make sure this strategy lines up with our community and our board. And if our board approves this strategy, then we're going to go back and you'll see us coming back in June with the measurement strategy, which I know that some of you, this is the exciting part. I'm with you. For those of you who we love the measurement part. But I just wanted to say you're going to see this a little bit different. We're going to bring some high level measures to the board, but and I'm happy to sit down and dive in with anybody. We might even start some office hours. I don't know. I hope Forhod's not in the room right now, but we're going to have full families of measures. That means outcome measures. That means process measures. That means balancing measures. Those are the measuring for the things you didn't necessarily intend. That means we're also going to look at leading indicators across the country. So we're going to be bringing you, I think, a slightly more comprehensive measurement strategy. And so again, that will be coming. We want to make sure the strategy is resonating and it meets kind of the board's expectation, and then we'll start working up against that, and we'll bring that back in June. With that, I'm actually going to hand over to Crystal so she can get to the really exciting part of this presentation, which is our 2027 proposed budget.
Thank you. Wow. I know. This is great. Yes, sir.
Yeah, just before you get more, and I know this all sort of blends into sort of one big plan, but we do have three separate items. David, I'm actually looking to you on it. Is that the conclusion of the strategic plan and we're now moving into 10.2? Do we want to approve strategic plan first, or do we do it all at once?
And we're going to ask you to accept the strategy, approve the budget, and then approve the 3-year.
Okay.
We have a slide for that.
So we'll go through everything and then approve it all at once and do comment as well. Okay, thank you.
Michael, I have a question. Do you prefer if we save questions or ask them as they occur?
I think it would be worthwhile to save them at the end, and then we can kind of dive into as much detail or questions as you have.
Thank you.
Yeah. Okay, you ready for this? I'm very proud to say that I think our 2027 budget really reflects the commitment to the True North and the aims of the True North. We've incorporated the operating and capital investments into the 2027 budget. I think that demonstrates, again, our commitment to the execution of moving progress forward. I'm also going to say it's a continuing journey from things we started in 2026. So some of our very large capital projects began in 2026. They'll finish in 2027 and some in 2028. So 2027 continues to be a journey of that. The intent of the next few slides is really to take you through a high-level view of what is in your very detailed 75-page budget binder. So, and I'm happy to answer questions of the detail when we get to the end, but we're going to kind of hit the high-level marks of what's happening in our budget. So we're going to start just with the overview of the statement of revenue and expense, and I'll take you into some of these categories as we move through the slides. But for fiscal year 2027, we are targeting gross revenue of $832.6 million. This is actually a 5.9% increase when you compare it to our projected 2026. Deductions from revenue, this is I know most of you in the room are familiar with healthcare, but for our audience, what we bill is like never what we actually receive in the door as a cash payment. So when we talk about deductions from revenue, we're talking about contractual adjustments, financial assistance adjustments, bad debt adjustments, those sorts of things. So we are targeting $460.2 million in those deductions. That is a 8.2% increase if you compared that to our projected 2026. Other operating revenue, this is pretty much in line with what we saw in 2026. This is revenues from external areas of the health system, such as the retail community pharmacy, such as the child care center, our cafe outside the doors here. And that's going to stay pretty much the same. There's just a moderate increase there. Our wellness neighborhood, we do call this out separately because the board several years ago decided to dedicate property tax revenues specifically to fund the programming of the wellness neighborhood. So when you see that $1.6 million sitting there, that is property tax revenue that is used to fund the programming of the wellness neighborhood. That brings us to our total operating revenue of $396.6 million. That is a 3% increase as compared to what we're projecting for 2026. Our operating expenses are slated to be $383.2 million. That is a 7.3% increase as compared to 26. And then our earnings before interest, depreciation, and amortization, for those of you that are accountants and looking for the T in there, we don't pay taxes, so the T has been removed. So our EBITDA line is about $13.4 million, or 1.6% of our overall gross revenue. Fiscal year 26 is projecting to be a 3.5% EBITDA based on gross revenue. So we are demonstrating a decline from where our projected 26 year is supposedly going to end. Of course, we're not there yet. Non-operating expenses, these are things such as depreciation, interest expense, interest income, investment gains, all kind of merged together to form one number. And that is $16.3 million. The remaining amount of property tax revenues that we receive is 16.4. You would take the wellness neighborhood and that property tax line and combine them together for the grand total of property tax revenues we receive, which is about $18 million. 5.8 million of the 18 is restricted for use, dedicated to the general obligation bond debt service payment. And then that 1.6 obviously is being used for the wellness neighborhood. So that brings us to our bottom line. We are projecting a almost $5 million net income. Fiscal year 26 is projected to be 23.7 million. So about a $10 million decrease compared to what we were seeing for fiscal year 26. So that's an overview. One more thing I want to note is our gross revenue. To some of the things Anna was saying, 88% of our gross revenue is derived from the outpatient setting. Only about 12% is derived from our inpatient setting. So where we may be a critical access hospital, and that's super important for the inpatient needs of our community, most of our revenue is driven from the outpatient setting. All right, next we're going to kind of talk about what's impacting our revenue, and it also leads into what's affecting our deductions from revenue. So in our gross revenue, we have incorporated in that $800 million number, we are expecting some increases in our volumes. So that has been taken into consideration. We have incorporated the lab pricing reduction. So where we talk about a $2.3 million reduction in our net revenue. So that's significant because when we say net revenue, that actually means cash reduction, like cash not materializing into the door. So we have also taken that into consideration. We also had some other areas within our charges that we needed to adjust to help us keep up with labor costs, inflation costs. And so we did propose a rate increase in some other areas to assist us with offsetting some of those inflationary factors that we are seeing in 2027, which we'll talk about in the expense section. One thing to note is our payer mix is changing. Tahoe Forest traditionally has seen more commercial insurance than any other payer. And it was right between ending 25 and going into 26 that that changed. Medicare is now our top payer instead of commercial insurance. And that has implications on our net revenue because clearly Medicare does not reimburse the same as what insurance does. There's also two little captions at the bottom that talk about, impacts of what's happening with the federal and state landscape. One of the biggest ones we're going to feel pretty quickly is the changes in the Medi-Cal programming from some of you have heard it called the Big Beautiful Bill, HR1, or whatever you want to tag it with. And really, we've already started seeing some of the implications of that. On January 1st of 26, there was pretty much an enrollment freeze. And this is really related to those that might have an unsatisfactory documentation status. And so if those folks aren't going through the required exercise to renew their coverage, they will lose coverage. They will lose full coverage and maybe end up with emergency coverage only. So to me, that means I'm going to delay care till it's an emergency, and then I'm going to land in your emergency room. So it's not a favorable change by any means. We're also going to see more pressure on eligibility checks. So those covered by the Medi-Cal program will have to substantiate more often that they can stay on the Medi-Cal program. And if they don't go through the exercise to demonstrate that, again, their full coverage will eliminate. That starts 1/1 of 27. And then the other thing in 2027 that we're going to see is a shortened period of coverage. So Medi-Cal used to be once you qualified, you could go back 3 months for old claims and submit those for payment to Medi-Cal. They no longer are allowing a 3-month retro period. It's either 1 month or 2 month, depending on some classification. So we're going to see some impacts of that on our reimbursement as we move forward. That will put pressure on the 2027 budget. One last thing I wanted to mention is by kind of revamping our financial assistance for our community, I am hoping those that need to seek care, that feel like they can't afford care, will now feel comfortable coming forward. So we may see some additional impacts on our financial assistance within our net revenue section. And I don't consider that a bad thing. I consider that a necessity to serve our community. So we did take that into consideration as well in our budget. All right, full-time equivalent. Yes, I'm speaking finances. So 66.8% of our expense is related to salary, wages, and labor and benefits. It's our labor costs. And we measure our workforce with a calculation called a full-time equivalent. So even though budget 2027 says 1,241, we actually have over 1,400 actual employed people. So the difference between the two is whether you're a part-time status or a full-time status, et cetera. But we didn't want to forget to also highlight that we also have over 500 contracted folks that help support this health system, whether it's a physician or it's a coder or it's a biller. We have a lot of external folks that help support the operation. So we wanted to highlight that as well. When you're looking at this, you might say, wow, we're increasing our FTEs by 123 people if you look at budget 27 versus projected 26. Well, it can be very difficult to recruit in this area. And so really, we're not adding 123 FTEs. We're adding 23 because we're still trying to bring ourselves up to core level staffing. Positions that we were recruiting for, or we may have found someone and then another person left. So we're constantly balancing that core staffing level with additional needs. So really, we're reflecting a 23 FTE increase when you compare it to what we budgeted in 26. We're, as Anna mentioned in some of the other slides, we're investing in certain positions. We're investing in a chief transformation officer. We're investing in the budgeting office, business intelligence, climate action, financial assistance and transparency. We're opening some space. We need a few more EVS workers to help us with the additional space. We're adding someone in materials management because we have more square footage that our courier needs to go and go to. So we've added resources there. And of course, IT, with all the things that are happening with technology, cyber threats, AI, it's time to invest in that infrastructure. So we've done that as well. All right, operating expenses. Salary, wages, and benefits are projected to increase 4.7% over 2026. Our bargaining unit agreements call for a 4% wage increase as of July 1st. That has been built into this. Our physicians and their employment model, we have built in a overall 5% for that category. And of course, we had those 23, 24 additional FTEs that we built into the budget. So with those wage increases in new positions, we've also carried all that impact into our benefits section as well to make sure we accounted for increases in employer taxes and things, retirement plans and things of that nature. Professional fees, we have two categories. We have clinical and other. Clinical is really for contracted physicians or other clinical providers. That's gone up a little bit. This ebbs and flows as we have providers either join the employment model or drop off the employment model and go back to contracted. It's also additional resources that we may tap into for extended hours, virtual care, things of that nature. Other is really like legal or consulting fees. And really, one of the biggest investments here is that transformation center. So where you saw that $1.2 million on the previous slide, a component of that is in professional fees. But we also are investing in the governance piece and the workforce strategy piece on this particular line. Supplies are volume driven. So as we project increases in volume, we also project increases in supplies. We are provided data from our GPO on what we can anticipate as inflation, and that ranges anywhere from 5 to 10%, pharmaceuticals being the most expensive at the 10% end. So we did incorporate those inflationary factors into the supply costs. So they're actually projecting to be about 12.1% higher than what we're seeing in 26. Purchase services tends to be those services that we need to conduct internal or conduct for the organization, but don't do it internally. So we contract for snow removal. We might contract for repairs and maintenance, that sort of thing. And in this particular category, we have actually added some help to our project management office because they have a lengthy lift of projects that we're trying to implement in this year. They needed some additional resources. Also in IT for cybersecurity, inflationary issues we're seeing in the cost of things we need for our network or software. And we also have some investment for process improvement in this line. So purchase services are expected to go up 15.7%. One other thing in here is we actually contract for our security on our campus. And there is a new requirement on 1/1 of 27 for weapons detection. And so it's a new requirement of being able to, Louis will be able to speak to this if you have questions, but one of the biggest costs of implementing this unfunded mandate from the state of California is operational costs of additional security personnel. So that is also hitting this purchase service line. Other categories like utilities, rent, insurance, education, and all of those are going up due to inflation, without a doubt. And we did add additional dollars in there for education itself, education for the board, education for the staff, just education overall. So that leads us to operating expenses of $383.2 million. That is a 7.3% increase over 2026. Now we're going to talk a little bit about capital investments. These are big dollars. First of all, we are projecting to end 2026 with spending about $53.8 million. $40 million of the $46.8 million in construction is related to the Gateway West project, the Sierra Center, the North Shore Clinic, expansion within physical therapy, and seismic requirements. So as noted, they MPC 4, NPC 5 are those seismic requirements. So that was a majority of what we tackled in 2026. And those projects are carrying over into 2027. So we have $70.5 million planned. And let me stress that word, planned. Planned does not mean we're going to do it. It means it's in our plan, and we'll make sure it makes sense to do it. So within equipment, we have budgeted for that mobile clinic. It will cost us to buy the mobile clinic itself and put the technology in it that is needed to keep it mobile. We do intend to replace our OR towers. It's time, as well as some OR equipment. We also have some investments in some of the imaging areas. There's a lot more, but I'm kind of hitting the highlights here. Within IT, obviously that 1.5 million in AI investments is in there. It is time for us to upgrade our network infrastructure. It has been a few years since we've had that refresh. It is time to do that. So that is also budgeted in there. And we are also transitioning our communication and phone system over to newer times. And I actually think that will assist with some scheduling and other complaints that we hear within the community. In the projects and construction, we're going to continue the work on Gateway that's slated to open I shouldn't say open, completely done, both phases in 2028. So we have about $13.5 million for Gateway. Sierra Center, we expect to complete in 2027. We have $5 million for that. The North Shore Clinic, $1.7 million. We are removing the pool out of physical therapy and redoing that space to add additional treatment areas within physical therapy. That's going to be about $750,000. Of course, the Incline Surgical Enhancement Project, that is slated for $7.4 million. We are working to replace our PET CT scanner in the cancer program, $3.1 million. We need to address some mechanical, electrical, and plumbing issues. Some of our buildings are from 1978, 1990, although that doesn't sound that long ago, honestly. And the Western Addition, which just opened when I started here, is now considered old, which I don't get. So we have to put some funding into that whole MEP, mechanical, electrical planning. And of course, we still have seismic issues, which is slated for about $10 million to address MPC 5. So that's how we're getting to that $70.5 million for 27. $2.3 million of that is still funds we have left over from the $6 million municipal lease we already did. So we have that funds available. Thanks to the Duffields and the Incline Foundation, we have $6.4 million to put towards the surgical enhancement project. And the rest would at this time be funded out of operations. 2028, 2029, and 2030 are just a plan. And I can't stress that to you enough. It is a plan. And there are a lot of things that are planned in those future periods that really can be considered optional. So this was kind of that pie in the sky. If we could do everything we wanted to do, let's put it in there. And that's the approach we took. But by no means do we have to execute against $45 million in 2028 or even $62.8 million in 2030. But these numbers we use to also feed our forecast for the future. So we could take a look at if we were to do all this, what would it look like? Okay, let's continue on. I wanted to highlight certain investments here because I think they're pivotal to helping us accomplish some of the things within the True North. And even though it says budget fiscal year 2027, some of these are total project costs that may actually have spanned 3 years. So the mobile clinic investment is 2027. The Sierra Center, that's the grand total project of the Sierra Center, and which spanned over 26 and 27. The North Shore Clinic is also a 26-27 project, and it was a grand total of 6.7 million. Gateway is a 26, 27, and 28. It's a 3-year project, and that was 31.8 million. The Gateway West Clinic has the most potential to add capacity for the health system to help us improve our access issue. So that was a huge investment and should pay off. The physical therapy renovation, which is to take out that pool and add space, that's $1 million project. You've heard the surgical enhancements at Incline. And of course, the clinical AI technology, 1.5 million. So between these projects, we hope to be able to add 57,000 more visit capacity by doing these investments, which is a 34% increase from where we were in 2025. So in the financial world, we like to measure how we're doing. And over the years, we have decided on 9 key indicators that help us understand the health of the organization. And in our fiscal policy, we strive to have these indicators be at least at the BBB minus level, but always want to strive to be better. I mean, we're Tahoe Forest, why wouldn't we? So we hold ourselves out to also looking at what does A minus look like? And these ratings are really based upon information we get from Standard & Poor's, which is a bond rating agency. And they publish this every year. So the latest one was published in August of 25, and it was based upon 2024 data. And so when you look at the A minus ratings on the right, that's really what is represented here. Our projected fiscal year 26 indicators are there for you. And I wanted you to see the transition of these indicators from 26 to 27. And please don't think when you look at this that this is bad. We've deliberately made some significant investments in the 2027 budget. And if these indicators didn't move, then I'm probably doing my math wrong. So this was expected. And so when you look at days cash on hand, normally you want to see the trend of that indicator to go up. And in 2027, it's actually going down. But you also just saw the capital investment we were willing to make in 2027, and that's going to take cash to do it. So no surprise there. Just for comparison, BBB minus would be 108 days. So we're still above that BBB minus threshold. Days in accounts receivable, we want that to continue to go down. Love to be in the 40s. I'm pretty confident we're going to get there. We just need a little bit of time to keep ratcheting that down. MADS coverage, maximum annual debt service, that's what MADS stands for. That particular ratio you want to see go up. But in this case, you see we went down, but we're still above the A minus rating. Still a strong indicator. And then restricted cash to long-term debt, that one you also want to go up. Even though we went down, we're really close to that A minus. BBB is 118, so we're well above that threshold. And then long-term debt to capitalization, this one you want to see go down. We did go down. Woo woo. And so A minus is 25.1, and we're better than that. So the balance sheet indicators for 2027 are still very strong. So you might be going, why am I saying proceed with caution? I'm saying proceed with caution because we have committed to a very large investment in 2027 that really needs to deliver. It needs to deliver on access. It needs to deliver on transparency. It needs to deliver on efficiency. It has a lot to deliver on. And if we do that, then great. But if we start to see slippage that some of these things aren't working, then we're going to probably have to adjust in 28 and adjust in 29. So the proceed with caution is our indicators have dropped with intention. But when we move forward, we need to be deliberate, disciplined, and make sure that what we're investing in is producing the results we're expecting for the community and for the organization. So proceed with caution doesn't mean, oh my God, our numbers are horrible. That's not what I'm saying here. It's just saying we need to proceed with caution. We need to make sure these things really work and are materializing what we think should materialize. The last slide. Income statement. These indicators should all be going up. And of course, what you're seeing is they're all going down. And when you compare ourselves to A minus, our EBITDA margin is still very strong. Operating EBITDA margin strong. Operating margin, you might be going, oh my gosh, it's a negative. Well, I'll tell you the triple B plus is a minus 0.5%. So we're still better than them. And again, we're making some intentional investments that will be causing that operating margin to go negative. What we don't want to see is that to continue in 28, 29, and 30. We need to write that, but it's fine for now. And then our excess margin, we're at 3.3%, triple B minus is 2.8. So we're still totally fine there. So again, I'm just saying proceed with caution. Our indicators have changed with intent, and now we need to execute upon our plan for our community and for the financial well-being of the institution. And with that, we're at the end.
Actually, we're not quite at the end, Crystal. We're
I'm at the end.
Crystal's at the end. I'm gonna come
I'm
back
in.
to that. If that wasn't, has anybody ever heard Crystal say woohoo? I never have. Like, so I do want to say, I just wanted to do a quick shout out that we are, those 3 clinics with the 57,000 visits, one is opening this summer in the North Shore Clinic down in Tahoe City. And if that wasn't exciting enough, in October or the fall, Dylan told me to say the fall, Rite Aid and Gateway Phase 1 is opening. So, there's going to be stuff going on. So Crystal, really, I do need those scissors soon. But also we're going to have the fall forum in September 25th. And I know I'm kind of stealing Dr. Evans' thunder here. If you want to go to the mic, you absolutely can, because I know you can't resist it. And then I want to come back and ask the board.
You have that reputation. Thank you, Anna. Shout out, please come to the Fall Forum, September 25th. This is going to be astonishingly good. We are going to have the Thomas Hobday Medical Lectureship. Again, we're going to have Dr. Gurpreet Dhaliwal. He's an expert on artificial intelligence in healthcare. Great speaker. He's also a master diagnostician, and he was featured in the Atlantic actually about a month ago. So I strongly recommend you read that article in the Atlantic about him. He's great. We're also going to have Jim Morrison, who many of you probably know Jim. He is kind of a local legend, first skier to descend a very difficult terrain on Mount Everest. So this guy's really interesting, and we're looking to have a fireside chat with him. We're also going to do a panel discussion on search and rescue, and we're going to have a physician panel as well. I think Dr. Gladman's been roped into that one as well, to talk about how to maintain outstanding quality in healthcare in a remote setting in a geographical area like we have, and bringing technology into a community like this. So it's going to be a full day event. It's going to be great. Hope to see you all there. Did I miss anything?
And it is going to feature the Thomas Hobday Medical Lectureship.
It is.
Which we're
Yes.
really excited about to bring this into the fall forum. And we actually are joined by Pam Hobday tonight. So
We are.
shout out there, but no, we hope to see you there. But thank you so much, Dr. Evans. I knew that he would be able to do it justice better than me. With that, I just want to thank you all for listening to us talk through this discussion. I want to recognize our entire organization, starting with Crystal and Jay, but everyone who really helped shape this budget and this plan. It was different. It was different. And I will say we talked about, one of the things that I think our chair asked again, like, what does it look like to spend your privilege? This is what it looks like. This is really, we hope this sort of honors the direction of our community and the board. When you're ready, Chair, we are asking that you accept this True North strategy. You approve on a separate action, you approve the 2027 proposed fiscal year budget, and that you also approve the 3-year capital plan. We're happy with that. That ends our formal remarks. Happy to yield back to you and answer any questions or field any comments. I brought all kinds of reinforcements right here.
Well, thank you for a remarkable presentation. I'm ready, but I think there might be some comments and questions. Unless David tells me otherwise, audience input is always important. I think it's even more critical in this presentation tonight. So I do want to reserve some space first for the board to ask some questions and get some clarifications, but then encourage as much of a dynamic exchange with the audience as we can have. I do have my hammer, so if it gets a little unwieldy, I can maybe pull it back, but really want to create foster that culture of let's have a real conversation here as opposed to sort of board then, audience. So with that, I will open it up to those sitting alongside me for comments and questions.
I do have a couple of questions. Crystal, you've heard me say before, the most frequent question I get in the Safeway checkout line or the Squaw Valley locker room is, why is your digital imaging and lab tests so much more expensive than we can get down in Reno? So I'm pretty excited to hear that there is a program now that's going to reduce it by 25%, at least the labs. Is there anything coming up with digital imaging too?
So we have budgeted some funds to investigate another pilot program if it's doable around imaging services. So that would be something we evaluate in 2027 to see if there's something we can do with that. In the meantime, though, the financial assistance program that we're revamping can help serve some of the population that feels it's still unaffordable for them. And we would love to talk with them and see how we might be able to assist and instead of having them go down to Reno. It is very difficult for us to compete with Reno, whether it is freestanding imaging centers or even a Renown. Different state, different costs, different regulation. They have volume, more volume than we have. It's just we will never, ever be able to price ourselves to that level for where we are.
Yeah, but at least there's
an to do better.
My second question is, when I look back at the record of audited, not budgeted, but audited years, 23 through this year, our combination of charity care and bad debt is roughly 10 million, pretty consistently for the last 4 or 5 years. And you bumped it up to 30 million in this budget, presumably to cover those issues you've said. How did you make that calculation? I'm just curious. Is it really a...
Well, I'm swimming in a little bit of the unknown in this category. For one thing, when our revenues are going up as well, your financial assistance is going to carry with that because it's a component of that. But the impacts of HR1, we're just starting to get a feel for that. We have only had, we're in May, 5 months so far of what might be transpiring. We're trying to be proactive to help people, if they're currently on the Medi-Cal program, full scope Medi-Cal, even with their documentation status, they can keep that coverage if they pay attention to their mail,
Yeah.
do their re-verification, and are still living in California. So they can keep that coverage. So we're trying to be proactive to help with that. But if that coverage is change, it has a dramatic impact. And, we could have higher financial assistance situations because they're waiting for care, because they're waiting to go to the emergency room. Those create higher costs. So all of that is kind of in an unknown bucket of predictability. On top of that, the health and insurance exchanges have changed. The subsidies aren't there anymore, high deductible plans. So all that is feeding into the overall picture. And then add the expansion of wanting to help our community more for those that want to seek care at Tahoe Forest but feel like they can't afford it.
Mhm.
I'm layering in, that did not come out right.
Yeah.
Some added dollars to be able to assist with that.
Yeah.
So even though it is less than previous years, I actually budgeted it. That didn't come out right either.
What did you do?
At the same percentage. So the same 2% and the same 1.5%.
Okay. Thank you.
Oh, thank you. Thank you so much. I have a few questions. First of all, thank you. And thank you for the presentation. It's been wonderful. Enjoyed going through this book.
Wow.
And learned a lot from last year. First question, just on key discussion points on the prior fiscal year. This is the first year that I saw a 6.4% total gross revenue increase from last year. So it's the first time I've seen double digit, now so it's single digit. Outpatient gross revenue also going from double digit to single digit. Is that kind of the correlation that I can take out of this, that our revenue is still increasing, not as much because our outpatient visits are also not as increasing as much?
So inpatient, we've stayed relatively flat. So we're not really anticipating much change in our inpatient book of business. It really hasn't changed in a number of years. On the outpatient side, we have taken into consideration providers that doctors or mid-levels that we know are joining us, and we do expect additional volume from them. But we also have new spaces that are opening up and aren't quite fully prepared to go aggressive on the possible number of visits we could see from that impact. So, shoot me, but I remained relatively conservative in my approach.
No, I just want to thank you because as you mentioned, like, we need this, right? This is not a year or two down the road. We're already down below from outpatient. So thank you for doing this. Thank you for leaning in and looking, because already the numbers to me saying if we're reducing our outpatient gross revenue, we need help. We need more. And so thank you for I applaud this from looking at those numbers and understand it will take time. Which goes to the next one, I think, is the strategic priorities and the goals from last year. Like well, actually, let's take that back. How do we know this is going to succeed? And you say KPIs are TBD, correct, on success for this. Can I get a hint? Can I get a little bit of something? Is that, I know I don't want it to be.
The page.
If you go to page 37 to 39 in your 85-page document, we actually do provide a glimpse. Now, I won't commit Farhad to office hours, but it's possible those are in his future. But what I think you're going to see that is different is we are going to actually both our business intelligence as well as draw on external expertise. We will be speccing out every single measure. So you'll see a dashboard. That dashboard we'll be able to explain all of those measures to you. And it will be, I think, a possibly more comprehensive than maybe we've used in the past, because I do think some of the things that we are aiming for are not something that you might see a change in a year. Okay, or there's a number like a visit volume, right? We also want to be transparent and make sure that you see what we're doing as we're striving for that aim. So you understand that there are tests that are, being introduced, and we're tracking whether those changes are in fact an improvement. I think that there's a lot of ideas and there's a lot of changes sort of being introduced out there, but we are really going to push ourselves to hold ourselves to disciplined evaluation of what we're doing, because there's a whole lot of shiny objects out there. What we want to make sure is that what we're doing is actually improving, and those improvements match what the expectation is of our community. So yes, but if you want to look at page 37 to 39,
Be glad to look at that later tonight.
and like we can set aside some time for like a measurement workshop. I think that would be really fun.
I think it was just helpful because like obviously we're looking at finances. I just found myself saying, oh, yeah, the finances. And as a physician, we're not there for the finances. We're there for the patient. And so just how many patients did we see? How many did we take care of? How many community got, with our pediatrics from there? So thank you. I'd like to make a comment actually, because I know this is outpatient, 88%. I was really surprised because I had last year's as well. I like to keep my homework with me. On volumes. Both this one and today both say acute admissions are budgeted, but which is one lower, and both of them lower. We didn't do that last year. We had more. We actually had more projected volumes inpatient. I know there's a big caveat, lots of outpatient from there. That's interesting that it was, again, from industry trends are saying we should have less people in the hospital.
Mhm.
Last year we had more. Any thoughts? Any questions? I'm happy to give my thoughts or questions.
Sure, yeah, sure.
People, good people here, and systems. I know the hospitals have everything. I know the hospital has, being in quality, all the measures, all the, lots of CMS, everything is really built there, and a huge expansion of patient qualities. But there are really good people everywhere. And so just the question is, what are those the people that build success? The hospitals program, getting people in and out, getting more cases. What is that? What was secret pot? Or was it just luck that we had more people? The reason I ask, and there's a leading question, so I'll just get to the point. We have talent everywhere. And as we grow to the outpatient, I just want to make sure that the inpatient, if there's talent and there's things here and there's lessons to be learned because we're, again, beating industry trends in the inpatient, I don't want to ignore that as we go to the outpatient. And maybe there's some lessons learned.
And I would just say thank you for bringing that up. And many of those accolades, those awards, those were obtained this last year. So I would just say there has been no taking our foot off the accelerator in the inpatient. I mean, I don't know how many critical access hospitals have stroke certification, Dr. Gladman, in the state of California? I think it's, three. So we're one of three. So, and how many have trauma designation?
Yeah.
So and the stroke was just in December. So, there's in no way that we're taking our eye off the ball. And in fact, our chief operating officer, has like sort of direct oversight and purview over that inpatient operation. So we in no way it's not an either or. It will absolutely be a both and. We also know, I will just say, no matter what decisions we make, the mountain will deliver needs to our emergency. So and we have to be ready for those,
Yeah.
right? But one of the things I love so much about which I think we've had that down pat for a really long time, but one of the things I think is so important to acknowledge is that stroke certification, the geriatric accreditation. I mean, it's not just the mountain. I think that our emergency department has thought deeply about this community and making sure that we can, that people can age in place and that we're able to also care for those kind of needs. And I just really feel very, very lucky that we have these kind of forward-thinking staff in our organization.
The only other thing I would add is clearly CMS continues to push things that used to be on the inpatient only list to the outpatient. So that has impact as well as those statistics. The other thing is I truly believe the folks that work on our inpatient units are well-oiled machines. By being a critical access hospital and knowing we really can't get past that 25 cap, the efficiency in really being able to discharge patients to make room for new patients is just phenomenal. And I actually think that's something other larger institutions could probably learn from us because, when we start pushing up against having 22, 23 in-house, we're turning it. And then we have slow peaks. There's time where ICU is closed. So what you're looking at is an average versus kind of also that day-to-day demand. And so that can ebb and flow. Depends on flu season too. So things like that.
Last question. Thank you. Appreciate it.
Yeah, go.
That line crossing of Medicare and commercial on that graph, we didn't have it last year. It's interesting. It's kind of a surprise. It wasn't forecasted. Is it, and I may have missed it, so I apologize if I did. Different in cost, different receivables that we're getting from that, and any thoughts on why it crossed? Aging? Are we getting too much older population? Is it?
I know I'm getting older. So yes, there is data and just population data that says that Medicare population has continued to grow and expand, and that, the silver tsunami or whatever they want to call it, we need to be prepared for the expansion of the Medicare population. Part of the importance of maintaining critical access hospital status is that we get cost-based reimbursement for Medicare. And that is really quite critical to our ability to be financially viable, because if we were on fee schedule, it would be a much different picture. So even though commercial and Medicare flipped, if I had to pick the two to flip, those would be the two. If it was Medi-Cal or Medicaid that was pushing up above commercial or Medicare, that is also a whole different story. So being able to be cost-based reimbursed, maintaining what we call our 1206D, as in dog clinics that are considered outpatient departments of the hospital, that is what allows us to get better reimbursement from the Medicare program. The other thing is our Medicare population all tend to have secondary coverage. And there's a lot of places that don't have secondary coverage. So whatever Medicare doesn't cover, their secondary usually does. And that's also really helpful for us as an institution.
Thank you very much.
Board being board chief operating officer. I do want to just call out.
I do want to just call out on page 55 of your plan. You'll notice also that we did a market share assessment last year. We're expecting to see 1,200 additional seniors over the next 5 years. So I think that trend is here to stay.
Because aging is here to stay.
Aging is here.
Well, and as I noted in a presentation at the town earlier in last week or 2 weeks ago, people age differently here
Yeah,
than they do
definitely.
elsewhere. Yeah. Yeah.
Yeah. Do they ever?
Well,
I know them
to
all.
begin with, thank you. Thank you for the presentation on the True North and the budget and the walk between the two of them. I think it made it much more meaningful to me as a board member of this is where we're spending our money. This is in order to meet the goals or the intent of our community, our staff, everybody that's involved in healthcare. I appreciate the whole thing on aging. I think Dr. Gladman started us off really focusing on them with the GATA presentation. There's the age friendly, and as we continue to see the aging population coming here, that we need to really start paying attention to that. I know there's nowhere that we've talked about in terms of extension of our extended care center. We know that it's full, and that has always been a kind of a sticking point. And we'll continue to see seniors as long as there are children up here who have parents who live away from them. They'll be bringing them to the area, so we may see them on a periodic kind of visit. So again, remembering the aging population. The other thing that I wanted to bring up was the affordability. And so many of our residents have high deductibles. So are these individuals also eligible to talk to you about?
Absolutely.
Okay, so they come in under the same
Absolutely.
umbrella.
It doesn't matter if you have coverage in a high deductible plan. It's really based upon your family's household income situation. So you can have insurance with a $10,000 deductible, and that's not affordable,
Right.
and still may be able to work with us to meet some financial assistance where we can help reduce that burden.
Oh, thank you for that, because I think many of our ones who have payer coverage have that high
Yeah,
deductible.
you don't have to be uninsured.
Yeah.
You can be insured. You could even be Medicare without a secondary, and you can access financial assistance. So
And then my last comment is about the True North. I really appreciate number one, that you put it in the booklet because it's a reference. I can always look at it. Our community can look at it and hold us responsible to make sure that those are happening. And if they're not, why? What are we doing now to change that? And we have many things that we're looking at to help improve access. I'd like to hear more about how we're going to do that. We've got the mobile clinic. We've got telemedicine, and there are a lot of things that need to be put in place before we can even do that, you know, in terms of regulations, license, all of those things. So as things are starting to shape up with a plan, I'd like the board to be able to hear that. Because again, we're going to be asked to approve this. And we really don't know what's going to happen with those things. It's a plan. It's not concrete yet. So again, as things start to meld together and we're ready to talk to us about this is how we're going to do it, we'd love to have that. So thank you.
So one thing to note, I did not anticipate in the budget that we'd suddenly have a mobile clinic on July 1. So, and we're suddenly doing telemedicine on July 1. So a lot of these impacts that hopefully are positive really aren't until the second half of the fiscal year. So we have time to discuss and vet it out and what this looks like and what it means before I put anything in the budget related to it.
Thank you.
Me?
Mary?
Okay,
Yeah.
great, yeah. First of all, let me thank everybody for this amazing body of work that we've had tonight. I know there's many, many fingerprints on this document, and I'm sure all of you in this room have had your fingerprints on there as well, but thank you. It's
If
just
not, there are 500 voices.
exactly, if not, then one of your voices, although I did it 5 times. I confess. Oh, well, you know.
Mary, it's not confession. You didn't.
Okay. Yeah, and I had some angst as I first looked at these numbers and what have you, but I must say that any concerns that I had have been totally allayed by the fact that I know that this is just a plan, and I know that this organization has so much discipline and put so much rigor into everything that they do, that when we have those occasions to stop and check, we'll do that before we move forward. And I think that's wonderful. And another thing I wanted to say that I appreciated was the expenses going forward. Such a large portion of those have to do with community benefit. And I think that those are monies that have been delayed over the last few years. And so I'm really happy to see that we are moving forward on so many of those different ideas. In particular, that we're going to start with a mobile van, and that we're going to go into the laboratory, the lab costs and what have you, because that's where care begins. And so I think we're starting at the right place with all the right reasons. So, you know, again, I commend the organization for that. And then also, if you look at the action plan, which is further back in the book here, you'll see that it blends the True North with the community needs assessment, with the CRENTS market share data, with the healthcare environment data, and what have you. So I think it's very real. And I think that's going to be very important for our action plan to be something that we can really put into effect. So again, my thanks. I think that this is emblematic of the kind of energy and intelligence that this organization approaches everything. So thank you all.
So no questions? Just
I
now?
have, you know, at some point, I would like to see more granular data from the 5,000 voices. You know, I'd like to see, in particular, I'd like to see what the community thinks we need moving forward. You know, what they're projecting our needs might be, but that'll come later.
Wonderful.
Thank
Thank
you.
you. And as a reminder, the board through various committees and the work we do, we were informed of, as this plan was coming together. So a lot of questions were asked, during the formation of the plan. But with that, and I do want to transition to audience input, public comment, but also wrap in a question, noting we did get written comment, two pieces of written comment. I won't read them, but there was a consistent theme which will lead to my question. It looks like both of them came from sort of frontline staff. And there were concerns about, well, specifically in here, concerns about maybe staffing requests being denied and feeling overpressured, overworked, and maybe that some parts of the organization aren't being listened to. Can you shed some light on, as we think about the True North, which is a very ambitious plan, how are we as an organization making sure that we're reaching into all corners of the organization and respecting and I think as the community was saying, right, the community was saying, well, don't do these grandiose things until you do the basics right. I think we might be hearing from staff. And also I do hear, some grocery store comments as well. Hey, don't do these grandiose things until we make sure staff is really in a healthy place as well. So can you just comment a little bit on how the plan to include staff moving forward?
Yeah, so that's a great question, and thank you. I think a couple of things I will just say is that this plan is ambitious. This plan addresses many, many things. I think and it doesn't address everything. I think, we still have basic operational, I think, realities, challenges. This plan comes at the exact moment that we just got done doing budgeting, which is sort of when all the FTEs and changes happen. So I think that this is many of the things around the positions really has to do with, I think, us having to put in structures in place and processes around refining position control. I just cannot wait till our Chief Human Resources Officer gets here. I do want to acknowledge Louis as the interim Chief Human Resources Officer among many, many hats. But there are many, I think, structures, decisions, policies that have sort of brought us to today. And I think that we will move forward into the future. I think one of the things that I think I promised the board, and I have had many conversations with staff, not all staff, but as many as I can, is I was brought here to really help greet change. And I have promised that I will be fair, I will be consistent, I will be inclusive, but I won't hit the mark for everybody. But I hope that that is the experience that staff are feeling. We are, myself as the CEO, but also I would say as the leadership team, we are incorporating the feedback of the staff. Do we need more feedback? Absolutely. I think that's why I want to acknowledge Dr. Evans for really getting us out in executive rounds, and Kelsey for that being her graduate project. That was awesome. But we have a lot of work still to do. We're also working within a structure and an infrastructure that I think needs to sort of catch up to the future. The other thing is we won't always be able to say yes, or maybe, and I'm not saying it'll be a no, but it might be a not now, or maybe we can't quite get all the way there. So I think that the burden though is on us to make sure we're communicating that, we're being open, we're being transparent, and that staff have an opportunity to feel like they have an opportunity to share their concerns. They can actually give us an idea and actually be heard and have that idea genuinely considered. I think it is on our responsibility to try to incorporate all those ideas, and we probably won't be able to say yes to everything. I think we have, in terms of the budgeting and the workforce, though, I think we have a lot of opportunity to improve there. I think we have a lot of systems that we need to really get in place. And again, I could not be, I might be number two. I think Louis is the most excited about this CHRO. I'm tied for second with him because I think there's a lot of, there are a lot of structures, and those structures are not only impacting the work experience here, but they're impacting access. So I think, again, one of the things I think I also said is, I promised the board, and again, when I've had the opportunity, I promised the staff is we have a lot of change that we're going to need to introduce, but we also really have to do that in the context of no harm. I don't think it has to be harmful or painful, but it might always not be how you want it, when you want it, and the timing. But we can strive to kind of find that middle ground.
I think the only thing I would add is I'm looking forward to the opportunity of really embracing process improvement and improvement science. I mean, to be asking ourselves, what are we doing? Why are we doing it? And why are we doing that 20 times? Could we be doing it 10 times? I have one particular department that has really embraced some of this and have found ways to do more with the same. And so I think this is an opportunity as well for us to figure out if with some of these requests, can we do things differently that allow us to do more with the same? Because I'm certainly not advocating to reduce our labor force by any means, but we certainly need to figure out a way to be efficient and be able to do more with the same.
All right, good evening, board. Louis Ward, COO. I know we heard it earlier tonight, but this plan was shaped also by 3,000 pieces of information from our own staff. And we did that through a number of ways, through Prescaney surveys, through Mentimeters, and through an actual very purposeful video that was made in the development of the workforce strategy. So there was a lot of involvement from staff, and very purposefully on page 59, we call out that this is not the end of listening. This is only the start, and that we intend to have a strategy around continuous listening. So when we have employees, staff members that feel maybe they haven't, we want to open up new opportunities for them to be felt heard. Doesn't mean that we will always say yes. I don't think that's the job, but we definitely want to communicate, make sure that they've felt heard.
Thank you, Louis. And
I think it's already working. This is the first time we've gotten written comments to the board.
it is.
So it's already starting to work. We're getting feedback.
All right. And with that, let's transition to comments, questions from the audience. If you wouldn't mind, would be great just to have a conversation here. We do have the viewing audience as well. So for comments, questions, if you could step up to the microphone, just so those outside of the room can participate as well.
Microphone. Oh, is it on? Yes. Thank you. Now I see it. Good evening, Chair McGarry, board, staff, Anna, clinicians, everyone that's here. I'm Pam Hobday, community resident, owner of Pamela Hurd Associates, have been a volunteer here for 30 years. I wanted to give a little bit different perspective in some comments. This is an exemplary plan. This is my business, doing strategic plans. This is a Fortune 500 plan. This is a benchmarking plan for our region. I can't wait to send this to every general manager, to the town manager. They're just going to go, "What are you doing, Pam?" But they're going to get it tomorrow. Because first and foremost, when you think about getting input, and 6,500 or so, Kim and team,
pieces of data from community residents and outreach in 4 months. That does not happen in this community. I have never experienced those numbers. So that takes energy, innovation, a team that's just going to go for it, right? And then I really studied this plan. I read it 3 times. I had my staff do some benchmarking on some other small rural community hospitals, one larger than us, but their plans are not like this. And I just want to give some perspective. When I really look through Crystal's numbers, I just love them, Crystal. I even tried to call her to talk to her about them. Yeah, she was in a meeting. But just to give perspective, my clients love to try to benchmark to become Fortune 400 clients. To become a Fortune 400 clients, you have to reach $1 billion in revenue. Think about our projected gross revenue of $832,633. We're close. Million, I mean, yes. I'm talking millions and billions. Keep me honest, Crystal. And when I read that, I couldn't believe it because I'm thinking back on the strategic plans I've sat through and with so many of you for so many years. And as Kim says, we're not putting up little Band-Aids anymore, right? I mean, this is a huge business. And the components of beginning with 5,000 voices and then having a true north and really focusing on, health within reach, community guided support, and transformation. I encourage every single person in this room to have those in your head all the time, and everything you do, focus on those. And it's transparent. This plan is so transparent. And it's supportive. And it's dealing with what real people are feeling and thinking. And you're leading this. And I just really want to commend you on that. And I want to just have us just take a moment to think about our 95% patient satisfaction. That just does not happen. And consistently, right? And so the hard thing is when we talk about access, I don't know, Alice, I've heard access as an issue for years. And yet we're going to begin dealing with that. And at the same time, supporting our clinicians and knowing that once people see them, it's a 95%, patient satisfaction. So I believe you all asked, you listened, and I want to have a call to action with the community as a community member. I would like the community to step up now and be part of this. And I have an idea.
We are asking to keep comments to 3 minutes.
Fast.
So
This is the last comment.
over
Thank
right
you,
now.
Mike. Okay, thank you. I'll be very fast. When we think about access, I'd like to say to every community person who's listening, whenever you see an improvement, let someone know about it. Let everyone know in the clinics with your physicians. Just say, I saw an improvement from 2 months to 2 weeks, so that everyone knows this. And the community can then be part of, really benchmarking this. And for Rob, last comment, just for you guys, the balance sheet key indicators and the EBITDA, I was jumping up and down about. That, study that. Know it as a board, bring it up. Anna has it. I found it, I think, on page 39, as you said, Anna. The follow-up that Crystal has for operating margin and EBITDA margin is there. That is best practices. Thank you.
Thank you. And I don't know if anyone's kept Pam Hobday to 3 minutes, so we thank you very much. Well, of course, they were very positive comments. I lost track of time.
This is a small thing. Oh, sorry. My name is Dr. Johanna Koch, and I'm part of the hospital staff here. One of the small comments made on the spreadsheet for the finances was about the bond and the taxes that everybody in this community pays. And, you know, much of that goes to the debt. Some of it was not identified what it went to, meaning it was to be used for whatever, but part of it was for the wellness neighborhood. And I think there are a lot of people in this community who don't have any idea what the wellness neighborhood is, and that it might be beneficial to just take a second so that they know what their money is going for and how they can take advantage of that opportunity.
It's almost a, I kind of predicted that question actually, so. And I think we have our community health director here too, so if you want to come on up, you can. But the wellness neighborhood, the dollars that are there are really around services that should be accessed at no charge to our community members. So we're going to be doing like childbirth education. We also do food nutrition courses. We're doing Harvest of the Month, which is available at all of the schools. There is a various diabetes education, prenatal, breastfeeding, parent education, stress, resilience. These are all things that people seek out, and we have a staff and a team that are here to support that. Did I get it right? Come on.
Thank you. Hi, everyone. My name is Lauren Lasardo. I'm the Director of Community Health. Thank you, Louie. And some of the other components that are included in the wellness neighborhood are really getting at this alignment with True North and the community health needs assessment that was finished in February. And so some of the activities that you're going to see coming throughout the year are really going to be focused on the priorities that also came up from community voices, which were food insecurity, transportation access to care, so health within reach, as well as mental health and behavioral health and substance use. So those programs are going to be designed directly with community partners, with internal and external stakeholders at every level. So we'll be bringing a plan for you as well.
What are your efforts to make all these programs known?
We're working on an action plan that is currently being approved by the steering committee, and so we're hoping to make that known in August.
Okay.
Thanks.
This is your chance. Questions, comments, concerns?
Hey, I'm Dr. Gladman. I work in the ER. I'm just wondering, what's a chief transformation officer?
I love that question. Well, a couple of things. One is we're refining the position, but the transformation sort of arm, some of that will run out of operations, but things like the innovation, the connections directly to, I think, we would like to have a more meaningful connection maybe to the foundations and kind of, I think actually we are thinking in this a very broad way, sort of transformation with a capital T. I think that there is untapped potential in this region for many, many things, but some of them are going to also just be making sure that we are positioned to really leverage different investments. Maybe if we have, again, like an innovation fund, or we kind of partner with the foundations or something like that, we actually need to have an executive that can actually make sure that it actually happens. I mean, I wish I could do it. I think it's a job I would apply for, but I'm not free right now. But I think a couple of wait, I didn't hear it. What'd you say?
You can take it on.
Yeah.
One
No
more
more
hat
rooms
for him to
Lucy.
wear.
But no, I think it's Dr. Gladman. We're going to be working actually over the summer to refine that job description. But there are many institutions that have something like an innovation officer or transformation officer. They take shape in a variety of ways. I think you can expect ours to be sort of on the cutting edge because we are Tahoe Forest. So we're not going to go small here. And I think we are thinking about things like really somebody who's connected directly with strategy and operations at that intersection of what philanthropy, strategy, operations are doing, and really make sure that we're not missing sort of anything. There's so much going on. I mean, I think you and Kyle sort of over kind of trying to manage things like AI and stuff. There's so much going on across the landscape that what we don't want to do is miss an opportunity to basically seize a moment. And so there will be other things like research that I think you can anticipate the transformation officer will do, like, should we, and I'm just saying again, this will be determined, but I think the sky's the limit. Should we have an academic partner? Should we do more research again? Should we have an innovation arm? I mean, there are things we need to ask ourselves because I think, again, you saw sort of Crystal lay out what I would consider a very ambitious plan, but it's also a bold plan. And so we will have to back that up with like bold leadership. So it will be a bold leader that we're going to start off with that line one. I hope the chief human resources officer will accommodate my wish for it to say, you got to be bold. This person's bold. No, it's a good question though.
Anyone else? Any Zoom comments?
Not on Zoom right now, but we're just asking in the chat if anyone on Zoom has a public comment. I don't see any hands raised, but. There were up to 27. I think we have 22 right now.
Another record, I think. Yeah.
The cafeteria.
Okay. Well, then if there are no more comments or questions, I'll close out. We talk about this plan coming together over the last year, but this has really been a multi-year journey. And I think speaking for the board here, we were always complimentary and praise the patient satisfaction of, the 95+%. But we'd also ask the question about what about those we're not hearing from? What about those who aren't accessing care? And they represent a meaningful part of our community. And so, over the years, making sure we had the right leadership, making sure we were really pushing forward and driving the community listening. And Louis, I can't agree more. This is the starting. This is the beginning of a way we work. It's not a one and done when we talk about listening to the community. And as you pointed out, community is both inside the building and outside the building. But we as a board also see just unlimited potential for this health system. When we looked at the vision statement, and if you look at the back half of it, it says something along the lines of, it's too small for me to read, but to be the best mountain health system in the region. And we asked the question, why are we setting the bar so low? Why are we limiting ourselves to simply a mountain health? We do have the ability to be really the best in the country at what we choose to, right? That's a slippery slope. Best at what, right? And so that's part of this journey as well. But when we ask the question about what does it look like for a health system to be the center of health in a community, it goes beyond just sick care, injury and illness care, here for you when you need us, when you're hurt. But how do we support the community and health every day? This is a trend we're seeing nationally as well, right? Health systems are being asked to play a bigger role, not just in sort of the fee for service, do what you get paid for, but really being a meaningful partner with the community and asking the community to partner with us as well. And I've made reference in the past meetings to things like adolescent mental health. We can't do that alone, right? So what does that partnership with the school system look like, for example? And so those are some of the things we're exploring, but I've thoroughly enjoyed my 6 years on the board, but couldn't be more proud of the work that was done here and the direction the organization's going. I think, Mary, as you talked about, some of these investments are long overdue, and some of the reach into the community where I think we've been absent is just absolutely wonderful to see. So thank you, everyone, for not only the body of work that was presented tonight, but the journey we've been on over the last few years. And a reminder to everybody that this is a journey. This is, we're talking about 2027, but this is a lot of these things are 5-year, 10-year. This is going to be an ongoing effort, and glad to have everyone part of it. So with that, thank you very much for joining tonight, for your comments. We do need to take action on these items. We'll take them one by one. So item 10.1, the True North Strategic Plan, would be looking for a motion and a second.
I'll move to approve the True North 2030 strategic plan as presented.
I second.
We have a motion and a second. All in favor?
Aye.
Opposed? All right, strategic plan approved unanimously. Moving next, 10.2, the fiscal year 2027 budget.
Would move to approve the fiscal year 2027 budget as presented.
Would I ask for an amendment to that motion?
Mhm.
To include the 5% in the aggregate increase, just so I have that.
Yes.
Effective August 1st, 2026.
Yes.
Do you want to read that back there, just to make sure we have the right?
Approve the fiscal year 2027 budget as presented, inclusive of a 5% rate increase in aggregate effective August 1st, 2026.
Yes.
We have a motion and a second. All in favor?
Aye.
Opposed? Crystal, you may go on vacation now. Yes. Budget approved. And the final item, the 3-year capital plan, looking for a motion and a second.
I'll make a motion to approve the 3-year capital plan for fiscal year 2028 to 2030.
I'll second that.
Motion and a second. All in favor?
Aye.
Opposed? Capital plan approved unanimously. Thank you, everyone, and thank you. We do have one final item, which was board member reports. However, we did cover that in our prior open session, so we're good there. The final item is meeting adjourned. Thank you, everyone.
So do you want us to go to staff to address or?